Hello, I'm David Michael Ross. I'm here to address the Direct Care Subscription case study that we've all been working on our case studies. Mine is in Direct Care Subscriptions as far as systems thinking class, and I look forward to sharing this more with you. So let's get going. So the goal of our case study is, and our target goal is to address the problem and the lack of consumer-driven choices between doctors and client patients. What we're going to use here is systems thinking as far as marketing management practices to put healthcare packaging and pricing together so patients and doctors can actually have a direct connection between subscription. Doctors just list what their prices are, what it is per month, and patients can just, or clients can just buy the subscription package similar to the way you would buy or get a cell phone package for say $50 a month, and you can go in and have all these services done within that particular package. So that's basically what we're bringing up here as our case study. The problem as we see it is that the current healthcare market between doctors and client patients is really limited, and the reason it's limited is because care choice pricing is very opaque. You cannot tell what a price is, and so doctors are limited and patients are limited because there's a third-party payer, which is the insurance company that actually is the payer. That's a very unique system. It's not a direct pay system. It's a third-party payer system. So the context, and we're going to go over payments and costs, most individuals are now paying, or the system is now moving toward, where people have high deductibles. They're paying high deductible health plans, and they have very little choice about what what the prices they're paying or doctors are seeing, that kind of thing. And our cost in the U.S., as we know, is 1/6 of our economy. It's a $1 trillion economy, and we're the highest healthcare costs in the world. And so that's the context that we operate in. One of the things that's unique here is the hindering factors. We're going to go into the lack of adoption and then the change in the healthcare landscape. The hindering factors that are hindering adoption is that most people weren't aware of any changes in the law, but with the Affordable Care Act and what's called Obamacare, or referred to as Obamacare, the healthcare landscape has really changed. Now the law has changed where you can do a direct subscription from the doctor to a patient. Let me give you a metaphor. The metaphor is, if you have a car, we all have cars, we have to get them insured. So we would get our cars insured by an insurance company. By law, we have to do that. And that's collision damage, major collision, that kind of thing. Yet, if you have that same car and say you had to give some tune-up, or you have to get brake work or things like that done, and you would go to an auto mechanic, the principle here in the law change has allowed, similar to like an auto mechanic, if you have service done, say at Midas, and you have brake work done, right? You don't send the bill to the insurance company. You just make an arrangement with that particular shop, whatever particular auto shop that you go to. Well, that's the same thing as far as the law change, as far as having a direct subscription model for doctors. Doctors can list their prices in packages, and they won't file it with the insurance company. They'll just charge you a monthly subscription or annual subscription. Everything's paid, and you can see them as many times you want per that particular package. So that's the landscape. Let's go into facilitating factors, both the acceptance and changes in the healthcare subscription model. Some medical practices across the U.S. are adopting the new direct subscription payment since the law has passed within the last few years, from patients not filing health insurance but filing a subscription as a direct primary care. And the changes in the health subscription models I mentioned before, the benefits of the Affordable Care Act, or Obamacare, has opened up real consumer-driven choices, which is really important because the new law gives employees better health care and well-care choices, and subscription is coupled in, is now driving down costs for all of us. So let's talk about marketing management and systems thinking. First of all, it's the 4 Ps. So the first one is product. Let's go over the particular product that we're proposing here in this particular solution. So the product we're looking at is a direct care subscription as a service. It's a cloud-based online model for client patients to be used by mobile phones. So you'll have an application that you can actually download and actually, similar to like an Uber, you'll be able to tell where doctors are, what their prices are, that kind of thing, and you'll be able to tell what their subscription plans are. This enables also on the doctor's end to offer and package and price medical offerings, say a wellness checkup, or say someone has to have lab work or things like that. They can offer it for an annual monthly fee, and there's no filing with the insurance company, and yet all this occurs online. And then you would go and visit the doctor once you booked and paid for your monthly subscription. As far as the product, the direct subscription package allows multiple primary care visits, lab work for prepaid subscription. It is also designed for doctors looking to extend their medical practice to a growing number of individuals who want higher quality care, higher rates of visitation. Say you had an infection or something that you want to address with your child and you just wanted to visit the doctor 10 times without having to go through all the steps you have to go through as far as filing insurance claims. You could just pay the doctor directly with subscription, and your visitation and could go significantly up, and it would be a lower cost, and medical availability would be higher. So wellness care, health care, those things would benefit tremendously, and it would be a lot more cost effective. We'll get to that in a second. As far as marketing management, we're going to talk about three factors: place, promotion, and pricing. And with that, in marketing management, what we're looking at is place. Doctors and businesses, the place that this would occur would log in on their desktop or laptop or their mobile phone, and they would actually pick what particular subscription package they want, what doctor they want, that kind of thing. And as far as promotion, we would put together a team that would inform doctors by, direct marketing channels, sales channels, customer success representative, direct contact, email, web, social media, media channels, those kind of things, to let people know that this promotion is going forward. And as far as pricing will be commensurate. There's a huge cost savings if you do not have to file all the insurance claims, the filing, the refiling, the denials, all those kind of things as far as that go into. There's a lot of overhead with that, and actually it's about 40% of the cost as far as the pricing. So a lot of that would be returned back to the doctor to lower the cost. It would be something where you could see the actual price of this service, and it would be plain, and you could actually purchase it in a package, a subscription package. Let's go next into behavioral goals. Doctors as new behavioral goals that we're looking to in our marketing management piece here. Goal 1 is to create awareness for direct subscription and to include them in the new payment options. Goal 2 is to get the doctors to change their approaches toward accepting subscription pricing and packaging. Goal number 3 is to motivate physicians' staff to get in alignment with client patients who are looking to take up subscription packages and actually have a direct connection with the doctor. So the staff has to have systems and actual acceptance in their own work life, in their own workflow, to accept patients who are client patients who only want subscription and not file for insurance. So with client patients, let's look at the new behavior goals that we are looking to achieve there. With client patients, the new behavior goals are 1, to gain acceptance of client patients by them asking their doctors for direct subscription options. So obviously if there's a demand for it, doctors would take that in consideration as far as providing that particular care. So with that also, goal 2 is to drive adoption and use subscription payment options with the doctor. So actually the client patients would feel comfortable, with an app, downloading it, setting up, making payments, that kind of thing, and actually drive more adoption with themselves and their family, that kind of thing. So goal 3, to locate and set up subscription arrangements in advance with doctors. So this would be something like Uber. You could tell where doctors were and set up where they are, what their payments are, maybe a rating on the doctors and what kind of care they offer and what kind of packages they have. So a lot of this would have to be driven by data as far as research to find out, first to gather primary research data directly from doctors, client patients, by interview, survey, and user group. We have to get out in the field and really find out what's really working there. A couple key things that we're looking at: from a statewide standpoint, there are right now only 24 doctors that are practicing direct primary care, and there's 900 across the country. And so basically we would like to find out who they are. We want to find out who their patients are, what kind of systems and services they appreciate, and which ones they would like to see brought into the service. As far as medical services that are offered to them, and would they like transparent pricing, that kind of thing, so we can get that kind of data. Second is to gather secondary research data, and there's a lot of it that we've come across recently, and to find out from doctors, client, patients, what are the best subscription payment practices, and to better understand their adoption in the marketplace. So let's go into marketing segments very quickly here. Doctors and marketing segments, two areas we're looking to cover here are doctors accepting subscriptions and doctors not accepting subscriptions. On the doctors who accept subscriptions as a market segment, we've got to learn and see those that accept subscription, how they convince community leaders and stakeholders in the community to accept new payment landscape, to also align and expand their marketing education efforts with patient businesses. They've learned how to do this. We want to learn how, what's effective, what's working, what's really doing well for them. To show validation, we want to see, as far as the market segment as doctors, how do you show validation? How do you, grow your business, from using direct care subscriptions for your own business to lower your costs, increase quality of care, and drive your bottom line as far as increasing revenue and profits, that kind of thing, so you can grow your business. For doctors who are not accepting subscription, we're looking to find out and to inform and educate and provide awareness directly that there is validation for the subscription model, to drive messaging and to highlight advantages and have them convert over to the new payment models also. So for client patients, two marketing segments. What we're looking to is doctors who now accept payments as far as, client patients, to get them to accept, because most patients, most clients, most of us in the country do not know the law has changed in this way also. There's a lot of things they discuss about the Affordable Care Act, but this is a very little known thing, so there's a lot of information, a lot of education that needs to be brought to bear, and to drive the message and to highlight the advantages. And for the client patients not accepting, we need to show them a broad array of direct care packages, subscription for upgrades, promote social referrals, that kind of thing for family members. They can try the packages out for themselves, moms if they have kids, that kind of thing. So coming around into conclusion, the marketing strategy or our journey map as far as implementation, operationalizing are basically 3 steps. Step number 1 is to bring systems thinking to the forefront of our company. To set this is an exercise where we're able to think through all the pieces, all the parts, all the people, all the places and the things that we need to consider, and how it all works together as one complete system, and what the relationships are as far as thinking through how one thing affects another, or all of us affect one another, that kind of thing. We want to set the mission of our organization to understand how we best enable doctors, client patients to adopt a direct care subscription model. And then we want to systematically address the challenges with the platform technology, which will drive the greatest adoption. So we want to find out what works for people as far as their applications, mobile phones, those kind of things. And step 3, and finally, we want to gear up and be very strategic with community, stakeholders, partners, doctors, clients, patients, working with small businesses and clients to reflect a relationship between all stakeholders. So this is something that we're looking to put together as a startup, and we're using this exercise in this class and this work to start getting our thinking around, our head around where all the systematic intersections and overlaps and things where we can work together with different parts of the community, even the insurance companies, so that you'll be able to one day have, as a normal course, you can wake up, pull out your cell phone and your mobile phone, and be able to book a doctor by subscription, maybe $20 a month, $50 a month. Go in as many times as you need to, and it's already paid for. So that really is our objective, and also on the doctor's side, so that they can start have more quality care, not have as much overhead administration, reduce their costs, spend more time with their patients, and basically take the law and the technology, and bring it to their own clients so they can basically have lower costs and happier experience there. So with that, I want to thank you all. It's been a great class, and looking forward to your comments. And here are my references, and everyone have a great day. Cheers.